Social media is playing a growing role in raising awareness of mental health issues and disorders like ADHD.
I did a report in December about how many women in particular are discovering they have ADHD after learning more about it on TikTok. But there are also concerns about some of the information being shared. Dr. Frank McGeorge is here to explain why, Doc.
Well, Pam and Kim, there are concerns. Raising awareness, of course, is wonderful, but experts are finding misinformation about ADHD may also be putting some people at risk, leading them to diagnose themselves and not necessarily seek professional care.
ADHD, or attention deficit hyperactivity disorder, affects millions of children and adults. Medication and therapy can help manage symptoms, and social media is helping to reduce the stigma surrounding this disorder.
I think the whole conversation around mental health, of course, has changed for the better in the sense that people are actually quite open and honest about talking about their individual struggles. But the challenge or the flip side of it is that it almost becomes talked about term in the popular sphere where clinical terms might start to get misused.
Clinical psychiatrist Dr. Anthony Young and his colleagues started studying ADHD videos posted on TikTok after noticing more patients coming in for help with focus and concentration. Their research found of the top 100 most popular videos on ADHD, 52% were misleading, 27% were personal experiences, and 21% were useful. Young is concerned more people are diagnosing themselves with ADHD and potentially getting treatment they may not need.
If everybody starts identifying themselves as having ADHD, if like 10% becomes 20%, becomes 30, becomes 50, becomes 60%, then really what is the disorder that we're talking about here? Where are we drawing the line?
Now, if you suspect you may have ADHD, it is important to reach out to your doctor to begin the process of getting formally evaluated.
So important, yeah.
And clearly these videos are helping some people. Do researchers have any ideas on how to make them better?
Well, certainly some of them are helpful. And in fact, the videos were highly understandable, but most didn't actually share what to do next. So including that information would actually be helpful. The best videos, of course, tended to be uploaded by healthcare providers, but those were actually in the minority. So encouraging more medical professionals to create that content, I think that's probably also really important.
Yeah, that's key. All right. Thanks, Dr. McGeorge. We appreciate it.